Welcome to the XT Podcast, your ultimate destination for valuable insights, practical advice, and inspiring stories that will transform the way you experience business, governance, and life. Join your host, Ashutosh, as he dives deep into three distinct editions: Customer Experience Edition, where industry leaders discuss CX strategies, product brand, employee experience, digital innovations, and best practices for improving customer engagement, retention, and loyalty.
Welcome to another episode of the XT Podcast. I'm your host, Ashutosh Nandikar, and today we are going somewhere few conversations in healthcare or customer experience truly go. My guest today is Richard Schwartz, a man who spent over 3 decades at the intersection of life sciences, storytelling, and experience transformation. From documentary filmmaking on health anthropology to senior leadership roles across pharma, tech, data analytics, and CX consulting, he has done it all. He's worked with BMS, was an early member of WebMD and Medscape, and led strategy at consultancies, agencies, and platforms. But what truly sets him apart is his life's work, a philosophy he calls experience as a medicine. This is not just about CX, it's about clinical impact, human dignity, and how better experiences can literally heal. He describes himself, rightly so, as the Arthur Kirkland of healthcare. Yes, the Al Pacino one. Because as you'll hear, he doesn't hold back when systems fail the people they're supposed to serve. In this episode, we ask the big, uncomfortable questions. Why has healthcare lost the script on empathy? And how can we get it back? Can data and AI bring us closer to human connection? Or are they just new flavors of old dysfunction? How do we redesign systems, not just for efficiency, but for experience equity? And what does it mean to lead from purpose, not from policy? This one's honest, urgent, and deeply human. Whether you are a healthcare leader, a CX strategist, or simply someone navigating the system, we promise this episode will move you. Let's dive in. Thank you, Richard, for joining us at the XT podcast. It's a pleasure. Really appreciate your time.
Thank you, Ashutosh. I'm so thrilled to be here with you.
I was genuinely looking forward to this for a couple of reasons. Few of those will come out as I ask my questions, but one of the most important ones is your belief system. I haven't come across customer experience leaders who talk about CX as passionately and for whom this is not just a practice but a mission. And I know it is yours. So it's far more of a pleasure and a personal pleasure for me to be interacting with you. Really appreciate this.
Wonderful. Thank you so much.
Well, first things first, Richard, your big idea. Let's start with that: experience as a medicine.
hmm
When did this insight crystallize in your mind? And what was that moment in your career where you felt this is what we need to institutionalize, and what validated this belief for you?
Sure. Experience as a medicine kind of crystallized both professionally and personally. I had an opportunity to speak with Dr. Kelly Harding about the rabbit effect and with Dr. Alia Crum about the treatment effect. And both of those talk about human compassion and human connectivity inside of medicine, that the drug effect is one part. It's an important part, but it's only one part of how well we do and how confident we are in a medication. It has clinical implications, how the relationships and the experiences that we have. That was reinforced by the book Compassionomics by Drs. Tresiak and Mazzarelli, that cites thousands of peer-reviewed clinical studies on the importance of relationships. But on the personal note, I've worked in patient experience for my entire career. I've worked in clinician experiences and engagement my entire career. And then I got sick. And I don't talk about it often. I don't like to talk about it. I'm largely better now, but I'm sitting in the doctor's office, and the first time you hear those words come out of a doctor's mouth, you can have all the experience in the world of, I've done this. I've told other people what to do. I've written books on it. I've written websites. I've written strategies for brands. And suddenly it's you, and you're sitting there thinking, I just got a full-time job that I'm going to have for the rest of my life that pays in reverse. And I'm completely unqualified and I'm totally unprepared. And it hit me in that moment that the experiences I was about to have and the experiences I wanted to have were essential to getting better, period. They weren't just tangential. They were part of the medicine.
I hope you're feeling better now, Richard. I hope you're okay. Sorry to hear.
No, it's part. Look, it's part of life, and um, I've seen situations where people got a diagnosis, and they had to face it and they had to deal with it. And in some regards, the experience was wonderful. The clinical team behind them looked at them and said, "We got this. We're with you." Their family, their support network, we're with you. Relationships are so powerful. The relationships we have with the people that are closest to us, and the relationship we have with the people that are hopefully trying to help us, they really matter, and they are of clinical importance.
Cannot agree more with you, Richard. In fact, what I uniquely hear whenever I talk to you or whenever I read your articles is the emphasis on intent, of why we are doing what we are doing, why patient experience, right? Not just hundreds of surveys and hundreds of insights being analyzed, but outcomes.
Yeah.
In fact, you highlight this in one of your articles as well. The three keys for starting with intent. That's one of your phenomenal articles. Definitely be referring to that in the video description. But the challenge is, Richard, how does one shift the operational focus of the CX leaders from outcomes to the very intent of why we are doing what we are doing and the outcomes we want to achieve aligned to that intent?
Yeah, there's a couple of things. So that the whole notion of simplifying what customer experience is, I call it the algebra of experience, which is simply we all enter into any equation with expectations, and your expectations plus or minus the realities, that's your customer experience. That's your CX. That CX divided by what you actually did as a brand or as a company with the data that you got around where you missed or met their expectations, divided by that, and then multiplied by the impact of the actions you took. That's it. That's simply what the algebra of experience is. But if you don't reach out to your customers and let them know your intent, then they think you're getting feedback from them, or they don't even know you're getting feedback from them, and they feel like you're listening to them, but you're not doing anything. And if you've ever been in a conversation where you're telling somebody something and you're giving them feedback and they're not making eye contact, they're not listening, and they don't do anything about it, for me, that's the difference between empathy and compassion. We can have empathy, we can listen to somebody, but compassion is empathy's more athletic cousin. Compassion does something.
Nice.
Right. Intent, like some of the pharmaceutical companies that I work with, I've said to their executives, why would you not reach out to physicians and say, we're listening to you. We are asking you for your feedback. We are listening to you by observing how you're interacting with our data and interacting with our drug. And we have an intention in that. We don't intend just to learn more about you and how you think. Our intention is we're going to do something. We're going to let you know what we heard, and we're going to do something about it. And we're going to let you know the impact of those actions we've taken, because this is a relationship. This is a symbiotic relationship. So that's what I mean when I talk about intention. Like, broadcast it, tell people we're listening for feedback, we're observing for feedback, and we are going to understand it, and we are going to do something about it. If you've not set your sights on, if I put customer experience data in my annual report a year from now, what would it say? If you've not written that annual report headline from the future, that case study from the future, so that you can map against it, then you're going to miss the opportunity. It should be in your annual report.
How lovely. I love how you phrased it, the focus on intent, because I always say customer experience is not about CSAT scores and NPS scores and so on. It's rather about the brand promise. What is it that you're promising as a brand? That's the first thing. And then ensuring you deliver the promise no matter which journey, which stage, which touch point. That's what it is. And that's how you're emphasizing on the focus for intent. And here's the challenge then, because most often than not, CX leaders are bracketed into a post sale customer support, customer service function, when the actual transformation begins right from the point of time of crafting that promise, strategy, branding, positioning, marketing, the whole nine yards. So how do we make sure the leaders understand that CX is cross-functional, it's strategic, it crisscrosses functions, and it needs to start right at the top? How do we make that happen?
I think one, we lack kind of in industry, we lack a unified definition. And
Yes.
that's it's okay if individual pharmaceutical companies have their own definition, but all of you within the company better have the same definition of it, right? And if you think about it as a vertical, if you think about it as a department or a center of excellence, you better put an expiration date on it or else somebody else is going to. It's a horizontal. It's an operating system. It's how you work.
Yes.
And the best companies that think about experience think about it as an operating system. They don't think about, like, I'm okay when it's tied to marketing. I am. I think it runs a risk when it sits in marketing, right? We want to look at, can we reduce our cost of acquisition? Can we enhance our retention? And that's what marketing is all about. As soon as it becomes a validation tool for marketing, you've just stepped out of CX, though, right? It should be a mindset across your organization of customers break ties. And
Right.
right now, if you look at your organization, who breaks ties? The hippo, the highest paid person's opinion, breaks ties, period. But what if they're wrong? And what if the customers are telling us something different? And that is listening deeply to what people are saying. And it builds a better relationship with your customers. As a species, we're steeped in reciprocity. We wouldn't survive as a species unless we had relationships. Businesses don't survive without relationships. And if you ever get an email from me, in my salutation is a quote by an Anabaptist minister, David Augsburger, that says, being heard is so close to being loved that for the average person, the two are indistinguishable.
How beautiful.
And you just show your customers that they're heard. Particularly if I look at pharmaceutical and pick a market, you've got a bunch of compounds out there and they're all scientifically rigorous. So when science is on everybody's side, what's your differentiation? And the folks at Indigene and DT Consulting did a beautiful job with the research that they did last year that showed that 50% of a physician's decision criteria to prescribe a given drug is clinical, safe, and efficacious. Well, you needed that to be approved as a drug anyway.
Yes.
So what is the other? The other 35% of the other half is experiential, and 15% is corporate reputation, which is arguably part of the 50%, right? Do you create great science? But your corporate reputation is also the experiences that you create. So I think it's greater than 35%. And we don't focus enough on that 35%. We focus on the 50%. And then I think it's just more costly for you as a company to sell and market and manage and convince people of your science when you're focused on thumping your chest saying, look at me, look at me, look at me. It's reach and frequency and it's share of voice, but it's not share of heart.
In fact, I remember our last week's conversation, Richard, and I really feel our listeners would benefit from that insight, which is medical reps, when they approach a doctor in a clinic and they talk about the medicines and the pills and the prescriptions that they are here to pitch to the doctor, what is that one question that they should ask, but instead what they end up asking, which would be the best signal for whether the doctor has heard them and has understood the pitch or not? And I really found that question very interesting, Richard. It'll be lovely if you could recount that for the audience
Sure.
today.
And this was kind of born in a moment because we talked about scores earlier. And I'm not saying that net promoter score or especially the net promoter system developed by Fred Reichheld and Bain, I'm not saying it's a bad thing, right? I think the system is a lovely thing, the inner and the outer loop. And I'm not saying effort score and CSAT are a bad thing. But think about when a pharmaceutical rep goes out to see a doctor and, hopefully they get a visit, hopefully they get a couple minutes and hopefully they get to talk, but they're always closing, right? And their closing line is often something to the effect of, doctor, can I ask that for the next 10 patients you see, you consider X, Y, and Z? They're not asking them, are you likely to go down the hall and recommend us to a peer? What they're asking them is their likelihood to discuss.
Yes.
What is your likelihood to discuss this drug with a patient? Because if they're not going to discuss it, then you haven't given them a compelling enough reason that this is differentiated in some way. And it cannot be just differentiated clinically. It must also be differentiated experientially. I have another thought on that, though. We will compete on experience, hands down, period. If any pharma company does not think they are competing on experience today, I've got news for you. You are. You might not be focused on it. You might not be concentrated on it and doing it, but you are being competed against on experience. Great. That's a battleground. But there's also a common ground. And the common ground is we share customers. The doctors are just as easily pharma A and pharma B and device A and device B's customers. The patients. If you have hypertension, there's a good chance you have hyperlipidemia. We share patients. If you have diabetes, there's a good chance you have both of them. We share patients. And if one of you is great at experience and the other one is bad, it breaks down. If the payer is bad at experience, but the pharma company's good at it and the hospital system's great at it, somebody in that chain was the weak link, and that ultimately hurts the patient and it hurts everybody's business. Look, I don't hide from it. Like, I'll talk about wonderful things like, it's not just ones and zeros, it's X's and O's. I'll talk about experience in medicine, but I am a capitalist, but I'm a conscientious capitalist, right? I want to do well by doing good. I got mirrors in my house, so when I look at them, I want to like what I see in the reflection.
Absolutely, Richard. You talk about listening to the patients, and focusing on what would help you differentiate when it comes to pharma drug A versus pharma drug B, right? And this brings me to a question on the voice of patients itself, Richard. You do talk about this extensively, which is solicited surveys is only half the truth, and a much bigger input and insight could be had from the unsolicited, unstructured data, which could be at scale, and without drowning in noise, you could actually glean amazing insights from it, which could help you differentiate. So for pharma to better embrace this, what would be your recommendations? What should they do so that they get to focus on something much larger and much more insightful than solicited feedback alone?
Yeah, I mean, we get caught up in the survey, and I'm not saying that surveys are dead. I think they're evolving in a lot of ways, and I'm not saying that they're not important, but they're a fraction of the signals that we generate. We are signal generating machines. And so the vocal minority, the people that will actually click on and take your survey or respond to your survey, is only a subset of your audience and what's actually happening. And there's bias in there. There's bias in when you ask, who you ask, how you
Yes.
ask, right? There's a ton of bias in that. Meanwhile, I'm going on your website. I'm going on your website in mobile, and I'm sitting in the pharmacy, or I'm sitting in my car. Those are signals. What I'm doing, where I'm doing it, how I'm doing it. I might call into your call center. And for too long, we've taken call center data and we've transcribed it, and then we've looked at it and say, well, what did they say? Well, that's great. But if I could say that phrase I just said, I could say that's great, or I could say that's great. Transcriptions don't pick up sarcasm. They don't pick up our lexical choices. So the caution there is don't let it get lost in transcription. Voice is a massive signal. I mean, the accelerometer in my phone knows how I'm moving, but the percussion sensor can predict that I might be having an asthma attack. We're generating signals all the time. Doctors are generating signals based on where they are, what practice they're in, where they graduated from, how they're prescribing, how they're diagnosing, how they're misdiagnosing. All of those signals about the experiences people are having are available to us. They're out there. They're in the ether. We're just not harnessing them and acting on them. So if the only mechanism you have is a survey, you could make partial decisions based on all the data that's available because you're only looking at a microcosm of data.
Can't agree more, Richard.
You know what's fascinating, by the way, I didn't mean to step on you, is agentic and true agentic AI changes everything. And when I say true agentic, I mean agentic became a buzzword very quickly, probably one of the fastest terms I've seen become a buzzword, and suddenly everybody was saying agentic AI. All right. It oftentimes is just PowerPoint, and oftentimes it's just a chatbot. So you want to look and understand, is this truly autonomous? Is this an autonomous agent? Is this an autonomous sentinel that has human guidance, but is solving a problem? Well, if that agent is out there solving a customer problem for them, it's generating signals about the experience all the time. I never had to ask anybody anything.
Yes.
That's a fascinating sea shift. And Roy Amara, who was a futurist and passed away some years ago, 40 years ago, he created Amara's Law, which says we tend to overestimate the impact of a technology in the short run and underestimate it in the long run.
Lovely.
Make no mistake about it, we are in the long run when it comes to AI and agentic AI. things are happening right now that we need to be cognizant of that are changing how customer experience is going to be viewed and operate and executed against.
Interesting you bring up agentic AI, Richard. I can't help but ask you this question with social listening, agentic AI, chatbots, you name it. There's just so much of tech, CX tech that could be deployed today. But it
Mhm.
seems that we are deploying more and more eyes, but we are not watching. It's as if we are listening to a lot of signals, but we are not leveraging any, or we are not acting on any. There seems to be a rush to listen but not rush to act, and there seems to be something broken in between. There's a lot of data that we're pulling in, we're investing in for the sake of it maybe, but we're not using the data to act. And why that gap?
It is a massive question. I think it's cultural. And I also think it's mechanical. So when I engage with the companies that I work with, one of the first things I want to tackle is your mindset. How are you thinking about this? How are you thinking about the customer experience? How are you thinking about the customer? And not just in terms of that person I want to write a prescription, that person I want to fill a prescription, because that person has other reasons for why they're doing what they're doing, right? I don't just want to take a medicine to get rid of my disease. Why do I want to get rid of my disease? Why do I want to be well? What am I aspiring to? And I don't just want your medicine to treat my patient. I want a relationship with my patient. So we're not always looking at the why. And so I help them think about the mindset around this and what it is we're setting out to change. And culturally, can we do that? But skill set is kind of the next click. Can you do
Yes.
this? Can you execute on this mechanically, physically? Do you have the organizational musculature to take feedback and do something with it? Because if you don't, I'm going to ask you to hit the pause button, because you might do the opposite. You start asking people questions. If we just go to surveys, you start asking doctors a bunch of questions and then you never do anything with it. They're like, why'd you ask me? You weren't going to do
Exactly.
anything. Why'd you ask me? And so having the mindset and having the skill set and recognizing where your gaps are and what partners you need, because partnerability is a capability. You will need partners along the way, and be choiceful about them. Be very choiceful about them. Then you can get down to the tool sets. You can get down to the technologies. If you buy the tool set first, I can guarantee you will be blaming the tool set for something. And those people that are out there selling you the technologies, they should slow down to speed up and think about, does this customer have the right mindset and do they have the right skill sets? Because otherwise, our tool set is going to be to blame for what didn't happen in those two steps. So once you've gone through mindset and skill set, if you are a tool set vendor or you are buying tool sets, then you have a North Star, you have a governing notion with which to guide everyone on what we're trying to execute. It's the same as I mentioned, writing that press release from the future, writing that, a year from now, what would it say in our annual report? That's what I'm talking about. That
Yes.
is what you should be building toward. I don't care how everybody gets to the moon, but everybody's got to know we're going to the moon.
Absolutely. Interestingly, we live in a world today, Richard, where the algorithms are becoming more and more human, but the humans are becoming more and more algorithmic. I can share an incident which happened, and this is a real life incident. I was in a room where a very senior leader walks in, welcomes everyone, says, "How are you doing today? How are you doing today?" Goes on welcoming everyone. One of the people there happens to say, "I fell down today, my knee badly hurt," and he said, "Well done, great. How are you doing today?" He just moved on. So he was just going through the motions, and I happened to note he clearly wasn't registering what was being said. He was just going through motions, and I think we do it with the CX today as well, right? We ask surveys what we could do, what is it we could improve, NPS, blah blah blah, and then no action, literally no action. We see the same things repeating. And in fact, it brings me to another paradox which you very humorously and rightly talk about, the Janet Jackson paradox. I can't help
Uh,
but ask you a question around it. On one side, the customers they have a very short memory. They'll forget a few things very quickly, easily, move on. But at the same time, they will be unforgiving for life as well. And it's
yeah.
quite a paradox in itself. And in such a world that we live in today, what is it that the brands can do to consistently be there and ensure that the trust lasts? And you say trust is gained in drops but lost in buckets. So in that world we live in, how is it that brands could ensure that the trust is built for life?
Trust is a killer metric. Helpfulness is a killer metric, right? The degree of helpfulness. But the Janet Jackson paradox occurred to me one day, sitting, thinking about the Super Bowl and thinking about going back to the Janet Jackson incident in the Super Bowl, but I started to think about in the context of customer experience. She had a song, and the line in Janet Jackson's song was, "What have you done for me lately?" I don't care how great that customer experience was, you're not done. Because that consumer is thinking, what have you done for me lately? And so what I do with companies is one of the first things I'll do when I engage with them is I will ask all of them, can you describe for me a memorable customer experience? And I don't say good and I don't say bad. I say memorable. And the reason I say memorable is I want them to draw on and recall something. It's almost always good. And when I ask them to describe that, the words are sentiment words. They felt heard, they felt listened to, they felt cared about. And then my next question is, do you do that in your business? Can you say that that is what you do in your business? Because if you don't expect of yourself what you expect for yourself, you're on the wrong path. And so you have to be constantly asking, what have I done for them lately? And I'll look at this device that I have. I mean, I have to cover up the logo, so we're not advertising. But it's not. It's just this year old enough to vote in the United States. It's just 18 years of age today. It's completely changed how we operate. But it's not the same one that came out in 2007. The reason I carry it everywhere I go, the reason we are so in love with our devices and so hooked on them is, one, they're addictive, but two, they're always thinking about what have they done for us lately. Yeah. So that's the Janet Jackson paradox. I've got some other paradox, but that's the one you asked about.
You, in fact, have this knack of coming up with this amazing lines and phrases, Richard. Another one that I loved is, no one gets a Pfizer tattoo. And I know that last week you changed it to, no one gets a good Pfizer tattoo. I know the distinction and the why as well. But it again points to a very interesting insight, again, which is in pharma, it's by definition, the business is such that it's very difficult to get an emotional loyalty, unlike few other businesses maybe. And when there is a difficulty in establishing an emotional stickiness with the patients, what is the part to differentiation? It's difficult when the emotional connect with the advertisers love to bank on, the brand experts love to bank.
Yeah.
When that itself is not a strong pillar, what is it that you could do to drive differentiation? I know it's an extension of a question on trust, but
It
explicitly
is.
around differentiation. What is it that brands could do?
I think the notion of being helpful, I think the notion of striving for creating awe with your customers. There's a great book that came out a few years ago by a gentleman named Dacher Keltner about awe. And he describes that people are most likely to experience awe in the presence of moral beauty. And moral beauty philosophically means one human doing something on behalf of another human. And that creates just these moments of awe, and we've experienced them. And sometimes they're more rare than they should be. When you see it and you feel it, you know it. Like, striving for that, I think, is a pretty big deal. And when I say nobody gets a Pfizer tattoo, that could be any brand, right? But what tattoos do they get? And I corrected myself because I went online when I first started to say that, and I realized that people actually do get Pfizer tattoos. It's just, as of today, according to the internet, no one's gotten a good Pfizer tattoo. But you see a lot of Harley tattoos, and you see a lot of Disney tattoos and Apple tattoos. Why? Why would somebody put a brand on their body? Even more simply, why would they wear the t-shirt? Why would I wear an Adidas t-shirt over an Under Armour t-shirt over a Nike t-shirt? Like, why? What is it about that brand that I connect with as a human? And that really matters. And then I start to look in the life sciences space. And the one that hit me was continuous glucose monitors that people wear. And some of the delivery devices people wear. And my question when I look at something like that is, what would make that person roll up their sleeve instead of pull it down over the device? Why would they not hide it? And what would they say if somebody asked, what is that? Because in that case, those people are wearing your brand. It's visible. But the problem is, we don't wear our brands because most of it's invisible. You don't wear your oncology medication. You don't wear your cardiovascular medication. You don't wear your neuroscience medicine. But what if they did? What if we thought about it? Like, what if they wore it? What would make them be okay with other people seeing it? How can we create that connection with people that they're proud to be in our drug? How do we create that moral beauty where they know we're doing something for them? Like, we genuinely care. We have to fulfill shareholder value. We have to. That's our job as a company. We have to sell our medications. We have to be efficient and effective in how we sell our products. That does not exclude us from being deeply human in doing so and understanding what is it this person needs. My old CEO from another company some years back had said, people don't buy quarter-inch drill bits, they buy quarter-inch holes. And I go, no, they don't. They don't. Like, I've never bought a quarter-inch hole. I said, I know what you're saying, that people buy results, they buy outcomes, but why? Like, if I didn't want the quarter-inch drill bit, I really didn't want the quarter-inch hole. Maybe what I wanted was to hang up a picture that my child drew when they were tiny because it makes me happy. I wanted to be happy.
Nice.
Why am I buying the medicine? I don't want your medicine. Like, you sell products that nobody wants. I don't want your drug. The last thing I want is to have a reason to have your drug. I want to be well. I want to be here for my family. I want to be able to, do the things I love to do and not be in pain or not be worried or anything. Like, that's what I want. That's what I ultimately want. I want to be able to connect with the humans that are around me. I want to live a healthy life. And, we're sometimes faced with the choice between a long life and a good life, and we have to choose one. And I think most of us would take the good life.
Absolutely. In fact, that reminds me of one of the healthcare providers here in India, which had a very interesting take on experience, patient experience. While most brands would want to brag about how customers keep coming to them time and again, this brand advertised that here, if you come once, you never have to come again. And I was quite happy to note that take, because it clearly showed their concern and care that we don't want you to be visiting us. We want you to live your life, have fun,
Yeah.
not even worry about having to take any healthcare. It's a lovely take. I loved it.
Yeah. I had a physician that treated a family member of mine. And one day, this physician just said, we're done. We're done. And he didn't mean like we're done, like I can't help you. He meant we're done. You're okay. You're good. Now,
Nice.
he said, don't take this the wrong way, but I hope to never see you again.
How lovely. How lovely.
Yeah. Like, you don't need me anymore. I've done my job for you. And that's pretty special. We don't always get that grace. We don't always get that opportunity, but the whole notion of you're here to give that person that better version of themselves that they're after is pretty cool.
One question, Richard, I would love to ask before I close, and this is something which
Yeah.
you passionately talked about in one of your recent articles, which is about the bridges collapsing in healthcare. Unless, as you rightly called out, there is a dent or a fall in market share, there is no focus or proactive effort being put into experience focused transformation. So this is as much reactive rather than proactive. And if there are any insights, recommendation, inputs, advice that you can give to healthcare leaders as to why they should be proactive and why the need to be proactive.
When I wrote that story, it actually came from something tragic that happened not far from where I live. I live about 40 miles north of Philadelphia. And one morning, a fuel truck was going under a bridge and it tipped over and it exploded.
Oh, gosh.
And it blew up the bridge, and the man that was driving it was tragically killed in that explosion. But the other thing that occurred was 5 is the corridor that runs up and down the East Coast of the United States. And suddenly it was broken. Like, the trucks couldn't get over, the commuters couldn't get over. The bridge was gone. It was obliterated. And the governor of Pennsylvania said, we're going to get it fixed in 2 weeks. And everybody said, you're not. You've been working on the bridge up the road for 20 years. You're not getting that fixed in 2 weeks. And they got it fixed in 13 days. They got it fixed, temporarily fixed, but fixed 13 days. So traffic resumed. What occurred to me in that moment is once you demonstrate that you can, you're out of excuses for why you don't.
Beautiful.
So if you fix that bridge in 13 days, why don't you fix every bridge in 13 days? Because you just reset the bar and there's no going back. You can't go, this one's 13 days, but that one's going to be 13 months. No, it's 13 days from now on. And brands have to think about that. Once you show customers that you can, that's your zero. That's your new bar. Right? Because if you can change things and you can do it efficiently and economically and solve for that, what a great way to run your business, right? It helps you figure out, like, they figured out how to do it in 13 days. That's crazy. Nobody thought it would come true. We all thought it was a lie. And then they exceeded the expectations. And not a city that normally exceeds expectations in a lot of ways, right? And guess what happened? They did that and they turned around and won the Super Bowl. You can't tell me those two things aren't connected. Like, it's the Rocky City, right? It's the city of Rocky. It's the city of triumph. It's the city that never quits. And they did that. And suddenly the city had tremendous confidence. And a year, 2 years down the road, they win the Super Bowl. I think somehow it's magically connected.
Very insightful. In fact, if you could be your own benchmark instead of the competitor, then what better than that? With that, thank you so
Yeah.
much, Richard, for your presence, for your participation, and your support to this podcast. I'm sure all the listeners would benefit from the insights. I will be sharing the links to the articles that I really loved reading and those that we referred here. So, for all the listeners, please give it a read. And I feel this conversation is not complete. Richard, I would love to have you another time on the podcast to discuss maybe a few things in depth. But till then, thank you so much and have a lovely weekend ahead. Thank you.
Let's do it. Let's count on it. Let's set a date. And thank you so much for having.